This week, a federal judge heard arguments on whether the state of Indiana's ban on gender-affirming care for transgender youth will take effect July 1st. It's one of the issues on the desk of the new president of the American Medical Association. Dr. Jesse Ehrenfeld is pushing for what he calls science-based medicine. Ehrenfeld is making history as the first openly gay leader of the nation's largest group of physicians. We sat down with him to discuss the issues and solutions facing doctors and patients today. Dr. Jesse Ehrenfeld is an anesthesiologist, Navy veteran, and father. What do you think is the top issue facing physicians today?
So after 3 years of experiencing so much stress with COVID, we've had this twindemic, a pandemic of the disease plus a pandemic of misinformation and bad information.
Dr. Ehrenfeld is taking over at a difficult time. Doctors are facing burnout, soaring medical costs, Medicare payment issues, and new legislation targeting the LGBTQ community and reproductive rights.
We have a healthcare system in crisis. I hear that from my physician colleagues.
How do we have a healthcare system in crisis?
So today there are so many backseat drivers telling us what to do, and we've got regulators that are discarding science and telling physicians how to practice medicine, putting barriers in care.
Those barriers include what he considers the criminalization of healthcare.
In at least 6 states now, if I practice evidence-based care, I can go to jail. It's frightening. When a patient shows up in my office, if I do the right thing from a scientific, from an ethical perspective, to know that that care is no longer legal, criminalized, and could wind me in prison.
What kind of care are you talking about?
So gender-affirming care, care for transgender patients, as well as abortion, reproductive health care.
What do you think is behind this criminalizing of doctor care?
Healthcare has been a target as of late in a way that has been deeply damaging, not just to the health of patients who are seeking specific services, but to every American. So we see patients who no longer can find an OBGYN because OBGYNs are leaving a state where they have criminalized certain aspects of care. That affects all women in the state.
Dr. Ehrenfeld hopes to improve health equity for all underserved groups, and he hopes to be a role model for any young doctors, and especially his own sons. What do you hope that they learn from you as president of the AMA?
Well, I hope that they learn that they shouldn't let anything get in their way of following their dream. And for anybody who's different out there, I hope that they see themselves, my children, the example that I've set, that they shouldn't let anybody tell them that they can't just because of who they are.
And as president of the AMA, Dr. Ehrenfeld now represents more than 270,000 doctors in the largest association of physician and medical students.